In this video, we will be talking about the importance of individuals getting tested for elevated blood lead levels. Did you know that lead is everywhere? No matter how careful you are with your surroundings, lead hazards can be found. These lead hazards can be affecting your family and your health. The only true way to know for sure you have elevated blood lead levels is a blood test. Who should be tested for lead poisoning and elevated levels? Children, ages 0 to 6 years. Universal screening is recommended in areas with high lead exposure risk. In other areas, targeted screening is done based on risk factors. Children living in older homes built before 1978, may contain lead-based paint, and children in these homes are at higher risk. Children in low-income households. Children in low-income families are more likely to live in older, potentially hazardous housing. Children with a history of lead exposure. This includes children who have lived in or visited homes built before 1978, or those who have siblings or playmates with lead poisoning. Children in immigrant, refugee, or adopted families. These children might have been exposed to lead in countries where lead regulations are less strict. Any child under the age of 6 that regularly eats or is exposed to spices from outside the U.S. Pregnant women. Women who are at risk of lead exposure, examples being living in an older home, working with lead, or using lead-containing products, should be tested as lead can harm the developing fetus. Adults. Occupational exposure. Adults who work in industries where lead is present. Examples being construction, painting, battery manufacturing, should be tested regularly. Hobbies involving lead. People who engage in hobbies that use lead, such as stained glass making, shooting ranges, or using lead-based products should consider testing. Professions, jobs associated with lead exposure. Painter, building renovator, auto mechanic, demolition worker, battery manufacturing worker, metal production worker, metal scrap cutting, recycling worker, plumber, welder, ceramic worker, gun range worker, sandblasting operator. Hobbies associated with lead exposure. Casting and soldering, car restoration, visiting gun range, ceramics, home remodeling, renovation, repair, painting, consuming, selling, making alternative cosmetics, ceremonial powders. Others. People living in high-risk areas. Testing is recommended for anyone living in communities with known lead contamination in water, soil, or air. Lead testing is typically done through a blood test, and early detection is crucial for preventing long-term health effects. Contact your primary physician, pediatrician to schedule blood lead testing. Lead testing is not a required screening and needs to be requested. How are lead tests performed? A finger prick or heel prick test. A capillary test is usually the first step to determine if a child has lead in their blood. Finger prick tests can provide fast results. However, they also can produce higher results if lead on the skin is captured in the sample. If the results are above CDC's blood lead reference value, it may be followed by a second test to confirm. A venous blood draw sample. A venous draw takes blood from the child's vein. This type of test can take a few days to receive results. It is often used to confirm blood lead levels seen in the first capillary test. Why is testing important? It is important due to the effects on the blood-brain barrier. There are some substances that can penetrate the blood-brain barrier and cause irreparable damage to the central nervous system. Lead is one such substance. Not only does it break through the blood-brain barrier, but it also increases its permeability, thus leaving the brain vulnerable to other toxic substances. When the blood-brain barrier is exposed to high levels of lead concentration, fluid can accumulate and cause cerebral edema. This leads to extreme intracranial pressure, which can result in irreversible brain damage. It also affects visual motor reasoning skills, causes deficits in attention and cognitive ability, and promotes brain cell death. The effects of having too much lead in the blood cannot be reversed. Symptoms of lead poisoning. In children, developmental delay, learning difficulties, slower growth, irritability, unusual behavior or emotional changes, loss of appetite, reduced desire to eat, weight loss, unintentional weight loss due to poor appetite, fatigue, feeling tired or lethargic, abdominal pain, stomach aches or cramps, vomiting, frequent nausea or vomiting, hearing loss, difficulty in hearing or processing sounds, constipation, difficulty in bowel movements, seizures, in severe cases, seizures or loss of consciousness. In adults, high blood pressure, hypertension that may be difficult to control, joint and muscle pain, general aches or stiffness, cognitive impairments, difficulties with memory or concentration, headaches, persistent or recurrent headaches, abdominal pain, stomach aches or cramps, mood disorders, depression, irritability, or mood swings, reproductive issues in men, reduced sperm count or abnormal sperm, miscarriage or premature birth, in women who are pregnant, chronic exposure, kidney damage. Long-term exposure can affect kidney function. Nerve damage, peripheral neuropathy leading to weakness or numbness in the limbs. Anemia, reduced red blood cells causing fatigue and weakness. Once blood tests have been conducted and levels are confirmed to be elevated, the Mecklenburg County Public Health Lead Program may be able to come check your residence for lead hazards. We will now go over the items most found within and around homes that contribute to elevated blood lead levels. Lead hazards are everywhere. Lead may be found in but not limited to the following: metal fixtures, ceramics, keys, spices, soil, ceremonial powders, paint, plumbing, jewelry, consumer products, water. As stated before, to ensure your family is safe from lead hazards, a blood test needs to be performed. Speak to your primary care physician to schedule a test today. For all children under the age of 6 and pregnant women who have tested positive for an elevated or poisoning level of lead in their blood, Mecklenburg County Environmental Health will schedule a lead hazard inspection of their home once test results are reported by a physician to the state of North Carolina. For homes and families who do not qualify for a lead hazard inspection from Mecklenburg County Environmental Health, please visit this website for a list of available vendors who are certified to inspect your home for lead. Exposure to lead can happen to anyone, and even small amounts of lead can be harmful to your child. Protect you and your family by scheduling an appointment with your family's physician today.